Hello, everyone. The guidelines for antibiotic prophylaxis have been a moving target for years, and it's absolutely critical to stay on top of the latest changes. So in this explainer, we're going to cut right through all the noise. We'll break down the definitive 2024 recommendations from the Canadian Dental Association and the American Heart Association, so you can walk into your clinic tomorrow and make these decisions with total confidence.
Okay, so let's start with ground zero. The entire reason we're even talking about this is a condition called infective endocarditis, or IE. It's a nasty infection of the heart center lining, and for a long time, dentistry has been in the spotlight. And you know why? Because some of our procedures can, introduce bacteria into the bloodstream. That's the connection, and that's exactly why we have to master these guidelines.
So, here's our game plan. First, we're going to tackle the big picture, the fundamental shift in thinking behind all of this. Then, we'll get super specific on the who, which patients are actually considered high risk. Just as important, who isn't. Then we'll cover the what, which procedures trigger the need for prophylaxis. And finally, we'll pull it all together to look at what the new standard of care really means day to day.
So, what's really the biggest change here? Honestly, it's the entire philosophy. We've moved away from this broad, let's cover everyone just in case approach to something much smarter, a targeted, risk-based model. Let's dig into what that actually looks like.
This single sentence right here, this is the heart of the entire update. It's a huge pivot from covering a wide net of patients to zooming in on a very small group. And notice the really specific wording, greatest risk of an adverse outcome. See, it's not just about the risk of getting IE, it's about the risk of a really bad result if they do get it. That's a crucial distinction.
And this slide just lays it out perfectly, right? The old way was all about trying to stop any possible case, no matter how remote. The new way? Well, it's a much more thoughtful balancing act. We now have to ask ourselves, for this specific patient sitting in my chair, do the benefits of giving this antibiotic clearly outweigh the very real risks? And let's be clear, this change didn't just happen out of nowhere. It's a direct response to two massive public health concerns. First, you've got the immediate risk to your patient, things like adverse drug reactions. But then there's the bigger, global threat of creating more and more drug-resistant bacteria. These are the serious risks we're weighing against the benefits.
Okay, so that brings us to the big question, the one we all need answered for our daily practice. Who are these patients at the greatest risk? This next part is the definitive checklist. This is the stuff you really need to know.
This is it. This is your core, high-risk group. If your patient has a prosthetic heart valve, or if they've had IE before, that's a huge red flag. A heart transplant recipient who then develops a valve problem, they're on the list. And finally, a few very specific, very serious congenital heart conditions. If your patient falls into one of these four categories, the prophylaxis alarm bells should definitely be going off.
All right, now for the flip side of that coin. This is just as important for practicing good medicine and avoiding overprescribing. Let's look at all the conditions that used to be on the list, but are no longer considered to require routine prophylaxis.
Man, look at this list. This is where you can really see how much things have changed. For literally years, something like mitral valve prolapse was an automatic yes for antibiotics. But the new guidelines are crystal clear. For the purpose of preventing IE, these patients are no longer considered high risk. This one slide clears up so much of the old confusion. So, here it is, side by side. Think of this as your quick clinical cheat sheet. On the left, you've got that very small, very specific group that needs prophylaxis. And on the right, a much larger group that doesn't. This is a great one to just burn into your memory for those moments in the clinic when you need a quick answer. Okay, great. So let's say we've identified a high-risk patient from that first list. Now what? We don't need to prescribe for every single thing we do, right? So the next question is, which procedures actually flip the switch and require prophylaxis?
Here's the guiding principle. And honestly, this is way better than just memorizing a long list of random procedures. Just think about the type of work you're doing. Are you manipulating the gingiva? Are you working down in the periapical region? Are you going to perforate the oral mucosa? If the answer is yes, and it's a high-risk patient, then boom, prophylaxis is indicated.
And to make things even clearer, the guidelines are also very specific about what doesn't require coverage, even for our high-risk folks. So things like routine injections through healthy tissue, taking x-rays, doing ortho adjustments, even minor bleeding if a kid bumps their lip, none of that meets the threshold. This clarity is so helpful for avoiding unnecessary antibiotics.
Okay, so this brings us to our final, really important point. The new standard of care is about so much more than just reaching for the prescription pad. It's a fundamental shift in how we think about prevention. We're moving from a single dose of a drug to a much broader, more continuous strategy.
And I've got to say, this might be the single most important takeaway from this entire explainer. The guidelines make it a point to say that the bacteremia from everyday life, from chewing food, from brushing teeth, that cumulative exposure is a way bigger threat than a single dental procedure. And what does that mean? It means our most powerful weapon is promoting fantastic, consistent oral hygiene and making sure our patients get regular professional cleanings.
So this all leaves us with one final, pretty profound question to think about. By reserving antibiotics for so few people, these guidelines have really reframed our role. Our primary function now in preventing these kinds of complications for all of our patients might just be to become champions for exceptional oral health. That's our new front line.